It's happened, guys. Massachusetts finally felt warmth. I forgot to turn that light on. Watch this. Watch this. I don't know if I can snap my finger with that hand. Wasn't that amazing? It's totally a snap-on light. That wasn't editing magic or anything. Anyway, you know, now that I've done that, I've proved I'm full of magic. You guys want to talk about Reddit? Well, here we are again. We're back in our chiropractic, and we're going to do two questions today. I find like two questions seems to work out the best. Seems to work out for the best for everybody, so it's not too long. That last episode, man, it dragged on longer than I thought it would. I got the rambling. But let's get started. Why does it seem like the people I'm going for help with pain don't mention hate chiropractors, I guess? My doctor didn't recommend it to me and recently went on my second round of physical therapy evaluation and didn't give me any sessions this time. He just gave me a paper and said, you can do it at home. I can move more than before, but I'm in pain every day if I'm not careful. I showed him an MRI I took and showed. The specialist told me I had liquid in my lower back messing with my nerves. He pushed it off saying you're getting older and pretty much have to live with pain. That is an absolutely unacceptable answer in my opinion, but let's keep going. Anyway, I asked him before I left, do you think some kind of chiropractor would help? And quickly he said, they're just going to crack you, and as long as you have that liquid, it wouldn't be a good idea. I was like, WTF. That's an abbreviation I think is okay. I think everybody knows what WTF means. It means what the flake. What the cornflake. If I wouldn't have this liquid, do you think he would have said, yes, maybe you should look into it? And in the beginning of my pain, the ER doctor scared the crap out of me saying they can paralyze you. When I asked about it as well, all I hear is negativity from these people. Well, suffice to say, that's a pretty interesting situation. Obviously, if you're having low back pain, it's pretty miserable in general, but for there to be a liquid in your low back, I have a few questions, shall we say. Shall we say. So you've gone through physical therapy, and it sounds like you've gone through their treatment plan, whatever that is, obviously is depending on the PT. Usually they'll treat you at least for like a month or two, varying amounts of time per week. But it sounds like that you've gone through what you say is a second round of physical therapy evaluation, which means that you probably finished one PT's exercise regime. Maybe they gave you a final exam or something like that, and maybe you went in for another one when the symptoms didn't fully resolve. It's hard to say. There's a lot of missing bits of information. That would definitely be something I would dive in first if I were to meet you or have you ask me this question or whatever. I will say that moving better is obviously good. That's what PT's there for 100%. For them to just say there's liquid in your low back, and certainly would hope they've tried to explain why the liquid's there. You showed him an MRI and you gave it to a specialist and there's liquid messing with your nerves. He brushed it off and he says you're getting older. That's not a really... I'm going to say that's kind of a lazy answer, in my opinion. Getting older, there's definitely problems that will occur that older people have to deal with more than younger people. Like, that's obviously an inevitability. But to say that you're just kind of have to deal with the pain, I'm not a huge fan of that answer. It's lazy. And I think if this doctor is worth his weight in not even gold, but just in I don't know, some kind of shiny metal that's not even very valuable, I do think that he would explore maybe potentially other options. Something I would be curious to know is if the area you're in is more rural or urban. I've always kind of wondered if rural areas are a little bit more finicky on chiropractors, not for any particular reason, but you do notice that there's obviously not as many chiros in rural areas. Chiropractors tend to enjoy the suburb type area or inside cities themselves, where there's just like higher amounts of people. The tell is that if you ask them about an idea that's something that he did not bring up and they have an immediate negative response to it, I mean, obviously there's going to be horror stories out there where doctors aren't huge fans of chiropractors because, there's definitely been some cases where chiros have done things they're not supposed to. But I would say that goes equally as both ways. I've definitely seen MDs do things that are definitely not in the patient's best interest, right? And I'm not going to sit here and point fingers and say one of us is worse than the other or it's okay because the other one did it. But I will say that in this situation, I think it's a bit of a disservice because if they're going to say, don't try this thing, even though you've tried, their way of doing it multiple times and you haven't gotten the results that you want, then I don't think there's any shame in trying to look for something else, right? Especially if you're not concerned about the other things that might stop you, like let's just say cost or even just like physical discomfort or whatever. For them to just say, no, don't do it without you at least going and getting a physical exam or something like that, I think is not a great way of treating people in general. And it kind of speaks to me of having ego involved in something that there really shouldn't be any ego involved in. I mean, there's been plenty of people that come to see me where I say, hey, go try something else. And if they're good with that and it helps them more than what I do, instead of thinking to myself, wow, I'm such a bad doctor, I couldn't be the exact fix for what this person needs, I think to myself, oh, I was good and I was lucky enough and knowledgeable enough to know, well, you're not in the right spot. Maybe you should go try this other thing, and that might actually help fix your problem. Why would they keep coming back to me if it's not necessarily something that they know can help that specific issue? But you also build a level of trust with these people where if you are, especially if you're willing to, I don't want to say self-sacrifice because it's really not self-sacrificing, but if you're willing to let somebody do something that does not in monetary form only serve me, well, then I think they're more likely to believe what I say, right? And I think that level of trust, that level of trust is hard to undersell, I guess would be a good way to put it. So the actual liquid in your back thing, if I had to take a lucky guess at this, and obviously there's a lot of, like, the body's complicated. I'm sure anybody watching this is going to know that obviously it can't just be boiled down to one thing. But if there's going to be liquid in your spine, I would be very curious to know what that liquid is. Have they ever tried to get any of it out? Have they done, like, I guess maybe not a biopsy, but have they pulled out any of the liquid that might be in there? Because there's a bunch of different liquids that can get into the area where the spine and the nerves are related. Now, and again, I think the term spine is used a little bit ubiquitously, because in the low back, if let's just say the liquid is in an area that's not necessarily on the spine itself, it could be pressing on like a spinal nerve or something like that. I think you have much more of a opportunity to figure out what might be causing your very specific issue. Because if you have something that's affecting the spine itself, it's going to be much more widespread. So like if you affect the low back, it's much more likely that both of your legs will start to act up as opposed to one side over the other. And they call that upper neuron and lower neuron lesions. Usually the symptoms that somebody has will give you a good indication on whether it's in the upper or the lower. Upper just means it's part of the central nervous system. Lower means that it's in peripheral nerves or the peripheral nervous system. And I think that if you aren't getting an explanation that tries to attribute it to something maybe a little bit more specific, in that, at least in that regard, and you haven't said, they might have, and you might not know the words or whatever in the situation. That's a whole nother point of discussion. But even just looking at it and having just a couple lines for your situation tells me that I think you're being underserved in regards to maybe some of the people that are trying to help you, especially since you are probably not understanding what could be wrong, if that makes sense, right? As far as if they would tell you to do chiropractic if you didn't have liquid in your spine, I'll tell you right now, a big cause for very temporary low back pain is something called the cyst, which is I'll put a definition up, but in a colloquial kind of way of putting it, it's essentially a bubble that forms somewhere in your body that gets filled with liquid as your body tries to like heal it. What causes cysts? A lot of times they don't really know. Certain kinds of cysts definitely have certain kinds of causes, but if you have a cyst that just randomly appears, a lot of times we don't really know what causes it. And it could be your body trying to heal something. It could be like a bacterial type thing, blah, blah, blah. And a lot of times a cyst can appear and disappear and you don't even know about it in the body because your body just takes care of it. But if you have something, as we like to call a space occupying lesion, which is just fancy words for something's growing in a place where there's not enough room to fully grow it, so it's going to grab something it's not supposed to, that can cause some consistent issues in that area, right? The good news is that once a cyst can kind of just randomly go away. Chiropractic, I can't say for sure or for utmost certainty that it gets rid of cysts per se. It can help reduce some of the pressure in the area just due to the fact that a chiropractic adjustment literally just adds space into an area, so that even if there is a cyst, it could potentially sit there at least for a little while, and it could give you some relief for the cyst to fully go away on its own, right? So if you have liquid in an area consistently over the course of, if you're getting at least more than one evaluation from a PT, this has been bothering you for months, this is not something that just happened overnight, then if you're having liquid stay in the area longer than it's really supposed to, I think the type of liquid is really important to know. Is it blood? Is it cerebral spinal fluid? Is it something else? Hopefully it's not like coffee or Dr. Pepper or anything. You don't want that in your body that's sitting around where it's not supposed to. But I will say that if you don't know the foundation of what it is exactly that's bothering you, it's hard to figure out a good solution. So why is it that a liquid in your back means that you have to work on like a core per se, right? I don't know, because I don't know what the liquid is. What's causing that liquid? Who knows? But that's not necessarily the entirety of this question. The real question is why is it that MDs and ER doctors or whoever you want to call it are all maybe not all anti-chiro. I will say first off, as time goes, I've been a chiro for coming up on 9-10 years. It has definitely gotten better, even in the small amount of time I've been here. MDs up here, at least in the Northeast, again, where you are, probably you'll get, your mileage might vary. But I'll tell you right now that MDs up here, very, very loving of having chiropractic in their treatments of like patients, especially when they have things that they know chiros can help with. Are all of them going to agree on it? Of course not. I'm doing a little bit of a broad brushstroke here, but I will say that up here, significantly more willingness to work with MDs. I love working with MDs. I love working with PTs. I really haven't bumped into any of them up here that have been like anti-chiro. There's definitely been a few I've talked to where they're just kind of unknowledgeable of what it is that chiros have to offer. And the really good thing is, if they are in that mind frame, it's a lot easier to be like, hey, you don't have to be scared of us if we kind of explain what it is that we do. A lot of the times, I think these people will be receptive to being partners and helping people. And I think ultimately that's what matters. I don't really care about the money of it or anything like that. If you have somebody who's going to multiple doctors, I mean, obviously, as we know, medical bills can pile up pretty extensively, right? And I think that maybe MDs think, oh, well, you shouldn't go to a chiro because of some kind of monetary issue. And that's definitely a reasonable thing to consider. Patients have to think about these things. And if a doctor at least has that in the back of their head, I think they're better able to serve people because they could like assuage their fear, be like, listen, it might be kind of expensive if you go to this chiro, but it's cheap. It's cheaper than going under the knife. You know, you do this, you try it for like a couple months or whatever. If it doesn't help, then you can stop, you know, blah, blah, blah. It's not like a huge deal if people are educated on it, right? And maybe that might not, and maybe that's something that they tell their patients also, or like, it's going to cost this much. Maybe you shouldn't go to a chiro. Maybe you should just go to a PT because insurance pays for this or blah, blah, blah. And I think that education will definitely always win out in the end because it helps you make more informed decisions. Now, all you hear is negativity from these people. Again, the very first thing I would want to know is where are you from like a geographic standpoint? Are you in a city? Are you in a rural area? Rural area, because that might inform their decision making, right? Because if they're out in the middle of nowhere, there might not be a lot of chiros around. Maybe they've just had bad experiences with the local chiros or blah blah blah. And as far as the paralyzing you thing goes, I mean, that I hear all the time. The amount of times I've gone to a place where somebody asks me what I do and I say, oh, I'm a chiro, inevitably someone's going to say, oh yeah, I hear that chiros can cause people to be paralyzed. You know, I'm sure that can happen. There are definitely going to be red flags involved with that. If it does happen, that is definitely not the norm. If you think about every single adjustment that happens, even in my office, let's just say hypothetically, let's just say I'm the only chiro in the entire world that has ever existed, right? And you come into my office, generally speaking, on a slow day, let's just say I treat 10 people. Each person that comes in, they're not just getting adjusted once. They're going to get adjusted at least like probably 3 times, one in each segment, depending on what it is that they need. We do some massage here. I relax pecs like no tomorrow because people's shoulders are always freaking out. And I'm usually mobilizing shoulders in a way that helps them move a lot better, right? And you figure, let's just say hypothetically, we get neck, just one segment of the neck, one segment of the mid back, of the thoracic spine, and one segment of the low back. Let's throw in a shoulder just for fun. That's 4 adjustments right there. Bada boom. And that's just assuming that you're adjusting one. A lot of times with thoracic, I'm going to get like a bunch of them because there's ribs and blah, blah, blah. But so if you come in here and you only get 4 adjustments, let's just say I see 10 people. That's 40 specific areas that I have mobilized. And if they all leave and not a single one of them has been paralyzed, I've been a chiro for this long and I ain't never paralyzed nobody. So you figure on a normal, slowish day, 10 people, 40. That's one day of the week. You take that number, you times it by 5 because I work 5 days a week. Then you take that number, and I work every week of the year. How many adjustments is that? Maybe I'll do the math here. Everybody calls me Dr. Math because I'm really great at math. Let me tell you, I'm super good at it. But for me to be able to adjust that many times and never see a single person become paralyzed, I've had some people with some adverse effects. Every chiro does. Sometimes you push on something and it just moves in a way that it doesn't like. Sometimes you might push a little too hard, blah, blah, blah. And then sometimes people will get a treatment and they're like, wow, my neck really hurts because you just moved something that hasn't moved for 30 years or whatever it happens to be. Are there adverse effects? Sure. I'll be the first to tell you, at least at the beginning when you first come in, hey, after this first adjustment, you might feel kind of achy. That's the most common side effect because we just moved a bunch of stuff that hasn't been moving properly in however long. But for them to come in and become paralyzed, if chiropractors were paralyzing people, that would definitely be something that would be more publicly known. And I'll tell you right now, the amount I pay for my malpractice, which is notoriously cheaper than most MD practices, it goes to show you insurance companies don't just say, hey, pay me this much because that's how much we feel it should cost. Insurance companies analyze this stuff. And if you think about the amount of money that I pay on a yearly basis, if that number is as low as it is, let's just say, because over the course of a year, I pay about, let's just say, it's not exactly a number, the exact number, but let's just say I pay about $2,000, give or take, right, for a year. I would be curious to know how much MD insurance is for a year. I guarantee you it's higher. because there's more opportunities for them to have adverse effects when it comes to drugs and all that kind of stuff. Not to say that you shouldn't go to an MD. They're trained to deal with that kind of stuff. And again, if that happened more than it really does, you'd hear about it more often, right? And so this is not an exercise in eroding trust in the system. What I would say is that if you look at the people who have money involved in this, if they've invested a certain amount of money, you best bet your butt that they have thought about this and they've looked at the numbers. For an MD to say, hey, don't go to this other person because they're going to get paralyzed, if you look at the evidence that has existed for the longest of times, it does not support that claim. And I'm going to be the first one to come out here and say, has it happened? I'm sure it has. There's something called the Jefferson burst fracture. It's beyond rare when it comes to going to a chiro, but it can happen. Now, if you're going to look at the history of everything that chiros have done over the years and you point at one example, okay, well, I guarantee you if I were to go through the catalog of history, I could point at another example that would prove right back at them. I don't want to hear it. It does happen. It's exceedingly rare. Regular people don't have to worry about it. Those people have usually pretty extraordinary kinds of symptoms, and they're wild. And there's always going to be exceptions, of course, right? So for them to say, oh yeah, you're going to be paralyzed, I don't know. I think it's a bit of a stretch. As far as any kind of medical person goes, don't leave your scope. Not to say that they're leaving their scope, because usually MDs, especially with PCPs and stuff like that, they have a pretty wide open scope to kind of do whatever they want. It's kind of crazy when you see what their scope actually entails and what it insinuates that they're allowed to do. I'm just going to say, if there was more of a negativeness to it that isn't just like a stigma of people not understanding something, it would be more readily apparent. I'll tell you that right now. If people are getting paralyzed, the amount of people that are getting treated with chiropractic adjustments and all that, I guarantee you would hear more personal stories of people going through that kind of stuff. And that's where I'm going to leave that. So let's go into the first comment. I like doctors who really want you to get better and are open to trying anything when they run out of solutions. No one should have to live with pain. Yeah, I'm with you there. Doctors who want to actually find a solution for you, I think that they're much more open to, trying different things, right? I would say there's definitely going to be some level of hesitation for things that maybe aren't quite as scientifically proven. Chiropractic has been proving itself scientifically for a very long time. Just Google chiropractic research. I guarantee you will find something that you probably did not expect. I'll tell you that right now. But I will say that if you are going to a doctor who is clearly trying to push, maybe not push an agenda, but they're already kind of trying to put you on a roadmap that goes to where it is that they want you to be, I would say at least ask for a second opinion. Not to say that maybe they're not right, of course. Doctors, are exposed to all kinds of different situations, and and being exposed to those certain things can predilect you for future things that might come into the office. I would say don't completely distrust them. Don't distrust your doctors. We are really doing our best to try and help you. But I will say that if you are if your tail's wiggling, as I like to say, if your tail is wiggling that something doesn't seem quite right, I would say don't hesitate. Just look for a second opinion. It doesn't hurt to ask somebody else's opinion about something, right? And the more information you have, the better it is. At least I think. There might be a little bit of an analysis paralysis on some level, I'm sure. But I just think that if you're feeling like something's not quite right, go for the second opinion and, make an informed decision from there. Here's another great comment. Either ignorance or gatekeeping chiropractic can help many named conditions. I think I read that wrong. I've read that in a way where there wasn't a period there. Don't mind me. Because of a shared underlying cause. For instance, nerve dysfunction in the cervical region can result in headaches, neck pain, shoulder pain, wrist pain. Most traditionally trained allopathic doctors follow a flowchart, which doesn't include chiropractic. Firstly, name the resulting condition and medicate. Then they send to PT, then to a neurologist or orthopedist, then pain management to receive cortisone injections or nerve ablation, then surgery. Chiropractic in various modalities, software, inferential, and low-level laser that I offer are safe and effective for the majority of neuromuscular conditions that patients commonly experience. Yeah, 100%. That really... That's a good way to put it in a much more succinct kind of way. Not to say that it's bad, but I will say allopathic doctors, generally speaking, they have a guideline that they follow. I forget what it's called. I'll see if I can find it up here. But there's a general accepted, here is the series of events that you're supposed to do if a certain condition walks into your practice. There is actually a document out there that says if the world was perfect, these are the steps that an MD would take for whatever condition that it happens to be. So if they come in and you're like, oh yeah, I think this might be Addison's disease or whatever, these are the steps that you should take with this person. You should send them to an endocrinologist to help with the issues that are happening, at least from that point of view. And anything that deviates from those steps, there's always going to be some personal preference. Like maybe an MD hasn't had a lot of good luck with maybe a particular kind of medication. Maybe they recommend a different kind of medication. Maybe they give you a prescription for a lower cost drug that maybe is not as effective, blah, blah. There's just so many factors. And I don't really think that most MDs are doing it in a way where they're doing it to be harmful, but it can kind of come out differently, right? And I think chiros do that too. I don't think that's just an MD thing for sure. And I will say that a lot of the various things that chiros do, we are doing our best to try and find things that make people less nervous, right? Sometimes somebody comes in and they're like, Dylan, Dr. D, I need you to crack me as loud as humanly possible, and I want to leave here feeling like I just got into a wrestling match with a bear. And I'm like, okay, go and lay on the table. That's very rare. I'll tell you that right now. Some people come in and they're like, I need you to treat me as gently as a flower that doesn't want to have the petals blown off by the breeze. Also okay. Nothing wrong with that. And most chiros are going to have both sets of those kinds of patients, right? You're going to have, sorry, I'm holding on to this. I'm playing it with my hand, a little fidget tool. You're going to have both sides of this. So if you have somebody who comes in who just wants the rough rack 'em, crack 'em, that's easy because most chiros know how to do big adjustments and big swings and blah, blah, blah. But if somebody comes in with a more gentle requirement, it's a lot easier for you to say, hey, lay on the table, let me use these instruments that aren't quite as forceful. It could be an activator, could be an arthrostim, could be a lot of different things. But if you look at something like laser, if you look at something like e-stim, and if you look at something like, even just like a massage, right? Those things are a lot softer, right? They're a lot less, I don't want to say brutal, but they're a lot less like forceful, right? And I think that a lot of people prefer that kind of stuff. And that's fine. Does every chiro want to do that kind of stuff? No. Does that wrong? Also no. But having a chiro who has more tools in their tool belt than only doing the big racky crackies, I think it will be able to help people a lot better because they can kind of meet them where they are on wherever they are, however they want to be treated, right? If that makes any sense. But I agree. That's absolutely the case. MDs, you have guidelines that they like to follow. I'm going to leave it at that. I could really dive into that one, but yeah, I tend to agree. I do think that MDs have their way of doing things, and chiros have their way of doing things, and I don't think it's fair to say, oh yeah, they're going to do this one particular thing or whatever, because there's just too many factors involved. You might think that I'm wearing maybe a different shirt. You really can't see the shirt in here. I had to pause when I was doing that last video, and I'm back. Don't worry. Not a moment lost. But yeah, we're gonna go right into the next comment for that last question. There's actually a response to the previous comment that adds a little bit more to it that I think is actually kind of interesting, and it goes to say, add to this that in many states and in Canada, it's illegal for a medical doctor to tell a patient not to consult a chiropractor or to say that chiropractic is dangerous. It's illegal because the scientific literature analyzed by experts says it's safe and effective. It's just an old disproven beliefs that stems from decades of medical anti-chiropractic propaganda by the American Medicine Association, the AMA. Look at that. See, did you see how he described what it was before he put the abbreviation? That's always wonderful. That always makes me smile. Look it up. Supreme Court found them guilty of sending false info to medical doctors, pushing for them to discourage chiropractic to their patient. Go see a chiro, mate. Doesn't solve everything, and it's not magic, but if your condition falls under what chiros treat, you'll wish you went sooner. Yeah, that's actually a really beautiful way to put it. Kind of what I was saying, maybe put a little bit more, again, as I like to say, a little bit more intelligently. He's absolutely right. The AMA, there was a big legal snafu, shall we say. It was back in like the 60s or 70s, if I remember right. Chiropractors did actually win that whole legal battle. The AMA was essentially trying to push out chiropractic. This was definitely at a time where chiros and MDs were a little bit more aggressive towards each other, shall we say. And I will stipulate that a lot of the claims that the AMA made were obviously definitely not truthful. And I would say even since the 70s, obviously you figure it's currently 2026. You see, I looked at the clock just to make sure I don't mess that up. It's 2026. You figure it's been at least, it's been almost like 50 years. And since then, the research has continuously come out to say that the benefits of chiropractic are myriad, and some of the things that the founders and the early chiropractors would claim, that there was a lot of scientific basis for it, but there wasn't anything that was really provable because there really wasn't any research in that field, because there wasn't really an opportunity. Because you figure research costs money, and back then, when you have just a fresh way of doing healthcare type stuff, if you don't have the money to do that research, it's hard to prove it, right? And so it's been fallen on chiros and other people, of course, but chiros have to prove why it is that we're valuable. And I think that has definitely happened. And a lot of that research comes out of Canada. Canada is always a very consistent area of legitimate research, as far as I know. Another big one that they did was the stroke thing that goes on with the neck, that's a whole other point of discussion. But it does go to show you that it's actually illegal for people in the medical field to talk outside of their scope. And where does that scope lie for MDs? Well, I think it's a little bit more loosey-goosey for them, because theirs tend to be maybe a little bit more open to interpretation, I guess. There's a little bit more wide-reaching, just because of the fact that they have the ideas of like pharmaceuticology and all the other things that they have access to. But they do very frequently, that I've seen at least people talk about online, there's a lot of MDs that just hate chiro. And whether that's more malicious because they don't like it that I don't know if they see us as competing or whatever, or if they just look at us like we're actually crazy and they find the research that backs up what they're thinking, right? And I think everybody's guilty of that in some way, right? I actually specifically will look up chiro research that maybe puts us in a more negative light, right? Because if that's the case, I can look at it and I know that there's something in there that doesn't, like, again, that makes my tail wiggle a tiny bit. Then it makes me think, okay, well, maybe it is that there's just still people putting stuff out there that's not necessarily true. At the extent of that, I don't know. I'm not an expert in it by any means, for sure. Obviously, I'm very one-sided. If I thought chiropractic was dangerous and I thought people were going to get hurt by it, I wouldn't do it. I'll just put it out there. That would be the first thing. If I didn't think that this worked, I wouldn't be here. Let's just put it that way. I wouldn't be making a video talking about it on the internet, because I'm sure anybody reading this, I'm sure nobody's going to be have an impassioned defense for maybe the opposite way of looking at it than me. And that's fine. I think that's fine. There's probably people that are going to listen to this and be like, wow, this Dr. D guy's an idiot. He doesn't know what he's talking about. But that's fine. Again, and as like I've said previously, I'm not here for those people. I'm here for the people that are actually kind of like in the middle. They're in the middle ground, that are curious about this kind of stuff, but they don't necessarily like to be forced into a decision that they don't necessarily want to make, if that makes sense. But there you go. That's that first question. Yeah, I think that sums it up pretty good. Go to Chiro's if you feel like it's warranted, and there might be people that tell you to not go see the Chiro because they don't think it's warranted, but ultimately it's not really up to them, right? It's up to you, and there you go. So be your own advocate, as they say. All right, here we go. This next one's kind of a big one, so if we don't do as many comments, don't be totally surprised, but this is a pretty big one. So the 3 things that helped resolve my lower back pain, and 1 easy fix you have to try. Yeah, I absolutely love that marketing strategy of this is the one thing they don't want you to know. It kind of smelled like that for at least a little bit. I did read it beforehand just to make sure it wasn't like them selling something, but I thought it was kind of interesting. But yeah, I did have a giggle at the one thing that they just don't want you to know. You see those ads all over the place. One random day in September 2024, I woke up with lower back pain that wouldn't go away. For context, I am a healthy, active 27-year-old female. I've never had back pain in my life, and the really annoying part about all of this is that no matter what I tried, I couldn't get it to go away. I had to stop most physical activities. I couldn't even bend down and pick up a pencil. I assume the injury might have started from straining my spine from dips in Bacata or bad form in Pilates. I admit, I don't know what Bacata is. I probably put up here because I'm probably going to look it up after I'm done with this question. I read that the first time. I was like, I don't actually know what that is. Bad form in Pilates. I mean, if you have bad form in Pilates, you could definitely cause something to hurt. Pilates, super great exercise, absolutely. But like every other exercise, you just want to make sure your form's good. But I couldn't remember any injury, and my MRIs came out totally normal except for a slight disc bulge. It's now June 2025. It's been 9 months later. Thank you for the clarification. And I'm finally 90% better. While I'm not at 100% like I used to be, I'm no longer stiff like a robot. I like that. And I'm back to all my old activities, including Pilates and even lifting weights. Hooray! That's exactly where we want me to be. Yay! Here are 3 things that help resolve my pain. Number 1, avoiding all triggers temporarily while your body heals. That means cutting out anything that worsens your back pain. Packing for a flight, don't bend down awkwardly. If it hurts your back, go on your knees or even sit on the floor. Sitting for hours, make sure you have ergonomic back support. Remove any physical activity from your routine if you wake up the next day with worse pain. Don't carry around a 16-inch MacBook Pro on long walks. However, do go on long walks as much as you can. Walking is great. Boom. Say it again in the back, y'all. That's all I'm saying. Any other triggers, though, avoid it. You have to take the recovery period seriously. The way I heard it on the Huberman Lab podcast about back pain, your muscular system is inflamed and extra sensitive at this time. If you keep stubbing your toe over and over again, the toe will continue to hurt. A back injury is no joke, and your muscles need proper rest to truly recover. I only really started seeing drastic improvement when I started avoiding triggers like the plague. After doing some time of doing this, I slowly was able to reintroduce them, and they were no longer triggering to me. Actually, you know what? Let me just interrupt it, just to make it so that this doesn't go into just a mad ramble. That absolutely is 100% the case. If you are discovering pain after a specific physical thing, whether it's like going to play pickleball, or it's whenever you do like a squat, or whenever you do a lunge, anytime you do like a back lift, any kind of thing, any kind of like specific activity, it is a good idea to take a break. And I will be the first one to tell you that I want you to get back to doing that movement, if you enjoyed it, of course, as quickly as humanly possible. But I do agree that the inflammation is there for a reason. The inflammation is there to heal it. And if you keep damaging it at a rate that is quicker than your body's ability to heal it, what's going to happen is it's just going to get worse, and eventually there might be a more consistent pain that pops up, right? My general rule of thumb is when you're working out and doing exercise, discomfort is okay, pain is not okay. And what does that mean? If you're lifting a weight and you are having difficulty with it, and that you find it like to be very challenging, or you're sweating in a way that you find uncomfortable, blah, 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 that's fine. That's what exercise is. That's what growth is. That's what they call like a eustress, which means good stress, as opposed to distress, which is bad stress. And if you're going to challenge your body like that, that's great. That makes you stronger. And in a lot of ways, that actually helps facilitate healing, because, again, exercise is good for you. If you're doing a movement and it hurts, like you feel a sharp stab, or you feel like something's about to pop, put the weight down. That's when you need to stop. Knowing the difference between pain and discomfort is going to be one of the most important things for any athlete, especially anybody that wants to exercise recreationally, just because of the fact that when you are just uncomfortable, that's actually a good thing in a lot of ways. Obviously within reason. Don't make yourself miserable, shall we say. But I do think that some people really do adhere to the whole adage of no pain, no gain. It doesn't quite roll off the tongue like no discomfort, no pain. Doesn't quite rhyme quite as well. The iambic pentameter is completely off. It's just not as catchy. But I will say that if you're going to do painful movements, it's going to be bad. It's just not going to end well if you keep threatening your body. Your body's either going to snap and it's going to hurt or it's going to hurt like butts, pardon my language, or it's going to essentially force you to put it down before you injure it, and that also feels like butts. Again, I apologize for my language, but yes, I agree with you. You have to at least take a step away from what it is that you're doing. I call it the form time. So if there's an exercise that you're doing where you notice that when you increase the weight, you start having a problem in whatever area, it's now time to drop the weight, maybe go to no weight, do body weight only, and then just focus on the form so that your body has time to recover from it. I usually give it about a week, give or take, as long as nothing was super torn, super bad, right? But if you're gonna go back to it, maybe even a little bit later, maybe start at a lower weight and just gradually increase back up to where you were, just so you know that the form is good, right? Because you just don't want to cause further injury. Number 2, I went to a really good PT who gave me daily core exercises, which at first sounded ridiculous to me because I've always had a really strong core. She said I had core instability and a weak pelvic floor. She also checked my glutes, which were both weak and tight. I was rolling my glutes every day and doing bird dog, bridges, clamshells with a band, etc. I used to get pain when doing one-legged bridges, planks, or dead bugs, but I remember the specific days miraculously when I was able to add each of these to my PT routine without pain. Incremental successes like that are huge. At one point, I got the hang of it and stopped going to my PT, and I started following this program, which really helped me in the final stages of my recovery. If you can't find a PT or don't want to pay for one, I couldn't recommend this program more. Worth every dollar. Backintelligence.com, the complete low back fix. I have never used that program in particular, but obviously if this person's having success with it, it would be something that maybe I would say might want to check out. I get nothing back from them or anything like that. But I do agree, core is usually one of the biggest things that will lead to pain in the back especially, but in a lot of places you wouldn't even expect it. The core has to be able to hold your spine still whenever you move, especially walking and stuff like that, because if your low back is moving willy-nilly with a core that's not holding everything down while you're doing it, what's going to happen is that the joints in those areas are going to get especially razzled, I guess is going to be the word we use. So just kind of keep that in mind. The weak pelvic floor and the core. Weak pelvic floor, I think, is something that is not something that I focus on a whole lot. I do know that it is 100% something that can help a lot of people. Women especially, I know that pelvic floors are really, really important, especially after doing something like giving birth to a kid or anything like that. It's something that you definitely want to pay attention to. With things like urinary incontinence and stuff like that, it's something that you want to keep your eyes on because that does help with that. I'm not super knowledgeable on it, so I'm just going to say I don't know it as much as I probably should, at least in regards to advocating for it on here. I don't think it's a bad thing. I think it'd be ridiculous to say that working out any muscle is bad per se, with a few exceptions. I'm sure there's always an exception. But yeah, the core, I will say, if nothing else, if there's no other kind of exercises that you want to do as a human being, you want to work on core and you want to work on walking type movements because the cardio is good for you and because walking is just a really great exercise in general. It works out pretty much your entire body for the most part. And it's actually a really good social thing too, is walking. You kind of escape the things that cause us to get stressed. If you walk with other people, it's actually really good for like community building. So walking, again, I just can't advocate for it enough. I love hearing people go for walks. Number 3, but the most unexpected thing that helped me and that I wish I knew sooner was magnesium. When I was around 70% better, I was slightly constipated one week, so I decided to take magnesium citrate, and oh my God, within just a few days, my back improved 10 million%, brother. She didn't actually say 10 million%. She just said 10. She just said 10 times. I have a digestive issues. SIBO. See, she didn't do the. You were the chosen one. You were talking about abbreviations. That is small intestinal bacterial overgrowth, is what SIBO means. I'm sure I'll put it up there. SIBO's pretty nasty stuff. It's not necessarily a chiropractic thing per se, but yeah, if you get SIBO's not the most enjoyable moment in your life as a human, I'll just put it that way, which can lead to malabsorption of certain nutrients, and it totally makes sense that I was just deficient. My body was taking so long to heal because it was missing the tools for muscle recovery. After this, I got a blood test, which confirmed that I have a suboptimal magnesium, vitamin D, and vitamin Bs as well. Next, I'm going to add vitamin D and vitamin Bs as well. Good luck to everybody, and happy to answer any questions. That last one is super important. Magnesium is one of the most recommended supplements in my office for sure. I'm a big fan of Calm. Again, I don't don't get anything back from them other than, I guess, what we sell in the office, I guess, which is a very indirect way for them to give me money for recommending something. But magnesium, the sleep blend specifically, I personally use every single day. It is magnificent. There's a lot of research out there that says that Americans are notoriously low in magnesium. Magnesium deficiency will cause muscle spasms due to the fact that it is what the body uses to relax the muscles in the at the cellular level. So whenever you have somebody move a muscle, right? So if you have a bicep, you curl it. Look at me. Boom. Like I'm huge. I'm huge. If you curl your bicep, what happens is the body takes calcium and it uses it to tighten the muscle because it's made of these little spindles, right? And so the calcium goes into the cell and it will flood it, which causes, there's like a bunch of little things. I won't go into too much detail. It's kind of a little difficult to grasp, but the idea is that when the calcium goes in there, it makes the muscle tense so that when that happens, it can move your joint closer together, right? So if it gets flooded with calcium, muscle gets smaller because it contracts. Now, in order to relax, magnesium has to go in there and essentially do the same thing that calcium does to let the muscle spindle relax. And that's a really kind of simple way to look at it. But when you think of the things that float around in our blood, magnesium and calcium are the two things that cause our muscles to contract and to not contract. There's a lot of other things. There's like nerve and blah, blah, blah. But at least for purposes of this example, calcium and magnesium are opposite of each other. In America, I'm not entirely sure how it works in the rest of the world with regards to food reinforcing and all that stuff. But in America, it's very easy to get calcium. They put calcium in a lot of things. It's very, very easy to get enough calcium that you need in order for your muscles to work properly, which is why you don't really hear about a lot of Americans having like flaccid muscles. That's not something you hear of. I don't think I've ever heard of that. And that's purely just because that calcium is in a lot of stuff that you don't really even expect it because it was reinforced however many years ago or whatever. Magnesium is only mostly in foods that Americans don't tend to get a whole lot of. It's mostly in nuts. And there's one nut that it's in that it's not in that I think is really, really popular. But for the most part, magnesium is in most nuts. So if you are somebody who does get a lot of, I'm pretty sure it's in peanut butter, or peanuts, I should say. I think you might be getting enough of it, but you got to remember that this is something that you have to have on maybe not a daily basis, but you have to get enough of it to fulfill your RDAs, right? And it is an essential mineral, which means that your body cannot make it. It cannot make it on its own. That is the difference between an essential and a non-essential mineral. Or vitamin, I guess it goes both ways, right? To bring it all together, magnesium is really, really good. In Americans, again, I'm not sure where this person's from, it is very frequently deficient. And I think last time I looked at research, it was like 60 or 70% of Americans just don't get enough. So you can just assume that unless you know you're getting enough magnesium in your diet, you probably are not getting enough of it in your diet. And that's purely because it's in foods that we just don't tend to put in our food, right? And it's not necessarily our fault. And I think a lot of the food that magnesium is in, I think it's quite delicious. I like chowing down on some cashews and stuff like that. But you got to remember that even if you do get enough of it dietarily speaking, somebody with SIBO might not be able to absorb it. Everybody has a different level of absorption in their stomach. There's certain things that you can absorb better than others, a lot of intrinsic factors, blah, blah, blah. So if you're eating food that is high in a mineral or the vitamin that you're trying to put into your body, but you still notice a lot of the side effects, it's a good idea to get it blood tested. And what happens with a blood test is that when you are trying to get something into your body, it has to go through your stomach, and at the stomach level, or I should say, it's the portal. Again, we're going really in depth here, but when you eat something, you want it to be able to come out of the food, whether it gets absorbed in the intestines or maybe it gets picked up in the portal vein or blah, blah, blah. That's mostly like fatty acids and blah, blah, blah. But if it goes through that interface of the intestines into your blood, that's essentially where you gain a lot of your minerals and stuff like that. If your body's not able to, at that level, take the mineral or vitamin and push it into the blood, well, there might be a reason. And a lot of times that has something to do, like chemically speaking, either from like a bacterial standpoint, or your body just doesn't create a factor that helps it detach it from a certain food as good as others. There's lots of different examples of stuff like that. And so if you just notice that you are constantly short on something, iron is something that a lot of people are very short in, it's a good idea to at least get a blood check. Because if you're getting a ton of it, but it's not in your blood, somewhere in between that interface of your tummy and your blood, something's not working quite right, or it's getting interrupted in some way where your body's just not able to get enough of it, or you're using so much of it that your body's having trouble keeping it in there. just because of whatever. Now, I'll say that personally, if it's magnesium and you're somebody who does a physical job, you're going to probably want to supplement magnesium, if not daily, pretty dang close. I know I do. And I feel great, right? And it just helps you kind of keep everything in control. And, you know, magnesium also helps relax your mind in regards to like anxieties and all that. So if you feel like you have an anxiety that you just don't have any control over, magnesium has been shown to help, to have some stuff in there that'll help. I think that Calm Sleep Bend is really great because it has GABA in it, which is gamma aminobutyric acid. Again, I'll probably put it up here. I just knew that one off the top of my head. That literally goes into your brain and shuts it down. It goes in there and it's like, all right, guys, everybody close up shop. We got to go to bed. We're done. We're done for the day. And it does, GABA is what a lot of people think melatonin is supposed to do. Matthew Walker has a really great book on it with his sleep, with the book on, he wrote a book on sleep. I can't exactly remember the title of it, but he goes over a lot of this. It's super fascinating to learn about how sleep works because it's a lot more complicated than you think. There's really no one-stop shop answer for improving your sleep. There's a lot of different factors that are involved in it, but magnesium, especially with GABA mixed with it, I don't think is going to make it any worse. Let's just put it that way. So there you go. That's a pretty great addition to the internet. Let's read some comments. Alrighty. Our first comment. This is probably the most comprehensive write-up for back pain. Personally, PT has helped me a lot, but it gets expensive very quickly. Plus, the time it drains is real. Setting up appointments, getting there, workout, then back. I just couldn't sustain it. I recently discovered an app called FlexPath on App Store. It is quick 15-minute PT workout, and it's cheap. I've been using it for the last 2 months, and no more back pain. Excellent. I love that. I do agree. I am not going to sit here and say that every single person has to pay crazy amounts of money to go to like particular healthcare specialists, because I do think that it does add up. I think the cost does add up. For people to find their own ways of helping themselves, I think is marvelous. I love PTs. I would never want to see a PT fail. What I have found is that there are people out there, you know, everybody's different. Some people really like going to work out with supervision, for lack of a better term. And a lot of times the PTs definitely offer other stuff that's not just workout related. A lot of times they'll offer like, you know, like some, maybe like a massage. A lot of them will do dry needling. There's a lot of other stuff that they'll do. There's a lot more modalities. And even talking to PTs that I know, you know, that I've worked with, some of them say, yeah, I kind of wish they would do the exercises at home so that we could do a lot of the other stuff that they can't necessarily do at home, you know, because most people don't just have an EMS machine at home, an electric muscle stimulation unit. See, again, I stated what that abbreviation was. And if they are at the PT's office, they're able to get that kind of stuff that they can't get at home. But a lot of PTs feel like they're just doing the same things with patients going through the exercise because they don't want to do them at home. And that's fine. I think that if patients don't want to do the exercise at home, if they're going somewhere to do it, that's better than nothing, right? But I do think that it leads to the usual the case of, you know, they go to PT, they do the exercises, they get told, hey, you can now do this at home, which I believe like one of the last questions, I think the last question talked about that, where they don't want to do it. And because they get busy. And that's not their fault necessarily, but it's a lack of understanding on why it is that they're doing the exercise itself. They know it's good for them, but they may not really know why. And as soon as the pain comes back, they think, oh, PT failed. No. And actually, that happens with chiros too. A lot of people will get adjusted and all that, and they'll feel the pain come back. They're, oh, chiro's a waste and it doesn't work and blah, blah, blah. No, actually quite the opposite. If you have a pain and then you notice that it goes away, I think almost very profoundly, I think it shows that it does work. But if it comes back, it goes to show you that whatever the core behavior or whatever the core issue is was not fully addressed. Whether that's a lifestyle factor or whether that is something that's actually like in the body that's not working correctly, well, that needs to be evaluated. And I think it's important to look for it, you know, as a physician. And it's a good idea as a patient to be mindful of like when it is that it bothers you. When does this thing not want to work properly? When does my leg get tight? Just drop my pen. Alrighty, here's the last one. It's getting hot in here, so I need to wrap this video before I cook. I'm gonna cook in this oven of an office. This post really resonates. I went through something almost identical before I finally found what worked for me. The magnesium tip is genuinely underrated. Most people have no idea how much muscle tension is tied to deficiency. I started taking magnesium glycinate before bed and noticed a difference in tightness within about 2 weeks. The only thing that made a huge difference for me was a spinal decompression at home using the Fisher traction device. I had a disc bulge at L4, L5, and physical therapy helped a bit, but the relief never lasted more than a day or two. What Fisher traction does is gently decompress the spine, which takes pressure off the disc and the surrounding nerves. I started using it 10 to 15 minutes a day, and after about 3 weeks, the chronic aching when sitting for long periods basically disappeared. What I think makes the difference is actually addressing the compression rather than just strengthening around it. Core work, stretching, and magnesium all help manage it, but decompression actually targets the root cause. For anyone reading this who hasn't tried a traction yet, it's worth looking into, especially if you've hit a wall with physio or chiro. Fisher Traction has a lot of info on how it works. Really glad the OP shared this post like this. Genuinely help people who are desperate for answers. Yeah, I tend to agree. I do think that there's a certain point where chiro and all that will help you. If you are noticing a plateau where you are not able to like not go to the chiro for, you know, whatever amount of time. I do think that finding something at home, I like the old doodad idea. You got to find a doodad at home to help you keep things moving. I agree that only exercises only can go so far because of the fact that if you exercise something and you're moving in a way that's not moving properly because the segments are not able to go through their full ranges of motion, which I believe I've talked about in another episode, getting adjusted and all that helps you get through that, right? If you have, and when you think about what an adjustment is, right, we're decompressing the spine in a way because we're adding movement and we're adding space. A decompression unit, something that you could use at home that might be really good for a lot of people, especially if people are older. If you're getting around that like 50 to 60-ish type age, you start losing a lot of your disc height, and some decompression could really, really go a long way. And I definitely recommend the magnesium. Again, I think the magnesium is absolutely, I think everybody should be on magnesium. Even if you are not necessarily deficient in it, just being sure you're getting enough of it will cause a lot of problems to just disappear. My general rule of thumb is if somebody has any mention of getting a muscle cramp in the middle of the night, like what they would call a Charlie horse, that is magnesium deficiency to the letter. You cannot get more specific than that. If you have a muscle cramp while sleeping, that is a magnesium deficiency. It's not potassium. I don't know why that's such a prevalent thought. I guess Big Bananas really got their hooks in us. Big Banana is a real thing. Make sure you look that up. There's that Banana Republic stuff. That's wild. That's a whole nother point of discussion. Yeah, I will say magnesium. Highly recommend it. Look for it. Disc bulges and all that, and even just getting some kind of traction unit. Traction units are great. Just make sure you know how to use it. Don't hurt yourself. Personally, I have equipment here that I use to decompress people's low backs. Actually, I'll send you the little camera. That's what they call a flexion distraction table. And its whole job is to put somebody on there and just take the table and literally just like push it down so that your spine opens up in a way that it might find constructive, right? And certain patients love it. Love it, 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 love, 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 love it. And it doesn't involve any popping or cracking. For the most part, you'll probably get one or two when you push them down if it's really stuck. But yeah, I think decompression is something that people could get a lot of benefit out of. I'll just put it that way. And I think I'm going to leave it there. I am going to go find some ice and rub it on my face so that I stop feeling like I'm in a heat cooker. I love you guys. Thank you very much for listening to this episode. And I hope you guys just have a wonderful week. You know, I do. You right there. I hope you have a great week, okay? You keep it popping. I'll talk to you later.